The cavity of the chest is filled with the two lungs and the mediastinum. The mediastinum is the median partition between the two lungs. The superior mediastinum is the part extending above the level of the sternal angle, while the anterior mediastinum is the part in front of the heart. The anterior mediastinum shows the sternopericardial ligament, which attaches the pericardium to the posterior surface of the body of the sternum. This is the pericardium, covering the heart, and this is the cardiac notch of the left lung, which allows the pericardium to come in direct contact with the sternum and is covered only by pleura. This is the lingula of the left lung, which is a projecting part from the lower end of the anterior border of the upper lobe. Notice the anterior border of the two lungs as they descend from the apex of each lung, descend downwards and medially till the level of the sternal angle. Then the anterior border of the right lung descends vertically, while that of the left lung shows the cardiac notch. This is the apex of the lung directed upwards and lies in the root of the neck and is covered by the suprapleural membrane. This is the base of the lung, which is concave and is directed downwards to rest on the cupola of the diaphragm. This is the thin anterior border. This is the thick posterior border. This is the lateral surface, which is convex and shows the grooves for the ribs. This is the medial surface, which is divided into a mediastinal part that comes in contact with the mediastinum and shows the hilum, and a vertebral posterior part which is thick around it and comes in contact with the vertebral column. The left lung is formed of two lobes, an upper and a lower. The upper lobe shows the cardiac notch and the lingula, which lies just below it. The two lobes are separated from each other by the oblique fissure. The right lung is broader than the left and has three lobes: upper, middle, and lower. The upper lobe is separated from the middle by a transverse fissure, which is absent in this specimen because of adhesion. This is the oblique fissure which separates the lower lobe from the other two lobes. Due to adhesions that may occur between the lobes, as we have seen here in this specimen, identification of whether the lung is right or left from the number of lobes is not always reliable. The sure way is to put the lung in the anatomical position on your body, with the apex directed upwards, the base downwards, the anterior thin border anteriorly, and the thick posterior border posteriorly, the mediastinal surface medially, and the convex lateral surface laterally. This is the right lung.